Hello, everyone, and thank you for joining me today. I'm Shar-Day Ali, and in this presentation, I will walk you through the full therapy process as practiced in social work, from identifying a client's needs to preparing for sessions, conducting the therapeutic interaction, and following up afterward. This approach is grounded in social work disposition number 6, which emphasizes competence and continual professional growth. As Chang, Decker, and Scott 2018 explain, effective therapy must be intentional, structured, and ethical. Today's presentation will highlight how communication, preparation, and evidence-based strategies shape the therapeutic experience and support client well-being. Let's begin with how we identify the need for therapy. Slide 2 shows identifying the need for therapy. The therapy process starts with recognizing when a client may need support. Social workers look carefully at the client's presenting concerns, stressors, and overall functioning. This may happen through an intake meeting, referral, crisis, contact, or through patterns the client reports. According to Chang, 2018, the assessment should focus on understanding the client's goals, clarifying expectations, and determining whether therapy is appropriate. Communication skills are essential at this stage, especially active listening and empathy. As demonstrated in Sage's communication videos, clients are more open when they feel heard and understood. Identifying the need for therapy lays the foundation for all subsequent steps. Slide 3, preparing for therapy. Before meeting with the client, social workers must prepare thoroughly. This includes reviewing intake materials, understanding the client's background, and clarifying the limits of the service we can provide. Preparation also includes ensuring that the physical environment is clean, calming, and welcoming. Sage's videos emphasize how much nonverbal communication influences safety. Something as simple as room setup can reduce a lot of anxiety. Practitioners prepare opening questions or prompts to guide the conversation while staying flexible with client needs. Chang 2018 remind us that competence requires being well informed, ethically grounded, and ready to adjust as new information emerges. Preparation is the unseen work that makes the session run smoothly. Slide 4, we're going to discuss opening the session. The beginning of the therapy session shapes the rest of the interaction. Social workers aim to greet clients warmly, establish support and rapport, and create a sense of safety. Reviewing confidentiality is essential because clients need to understand how their information will be protected. Sage 2020 emphasizes the clear communication and warm nonverbal verbal cues signal openness and support. During this opening, we clarify the structure of the session and invite the client to share what feels most important today. This aligns with client-centered practice and ensures that the session is collaborative rather than practitioner-led. Strong openings build trust and reduce uncertainty. Slide 5, we're going to discuss exploring the issues. Once the client feels grounded, we move into exploring their concerns. This phase relies heavily on active listening. Chang 2018 highlight techniques such as reflection of feeling, reflection of content, paraphrasing, and asking open-ended questions. These skills help the client feel understood while also clarifying themes and patterns that guide assessment. Sage's listening video emphasizes that nonverbal presence, eye contact, nodding, posture is just as important as verbal responses. During exploration, we avoid judgment, assumptions, or rushing toward solutions. The goal is to fully understand the client's story as they experience it. This depth of listening strengthens trust and it leads to more accurate treatment planning. Slide 6 delves into developing the plan of action. After exploring the client's concerns, the next step is developing a plan of action. This step must be collaborative because clients are more likely to engage when they participate in creating their goals. Together, we identify strengths, available resources, and potential barriers. Chang 2018 emphasizes empowerment based practice, which means supporting clients and recognizing their own capabilities. Here, we outline goals that are realistic, measurable, and meaningful to the client. We also discuss possible interventions and what each of us will contribute to the process. This planning stage aligns with professional competence because it requires structured, ethical, and client centered decision making. Slide 7 discusses applying interventions. Interventions must match the client's goals and the practitioner's competence. Social workers may draw from cognitive behavioral approaches, emotional regulation strategies, strengthens base interventions, or behavioral skill building. Chang 2018 stressed that intervention should be evidence-based and appropriate for the client's developmental stage, culture, and context. Sage's communication training videos show the importance of adapting strategies and ensuring the client feels respected and understood. Ethical practice requires us to remain aware of personal limitations and avoid using techniques we are not trained for, which directly reflects social work disposition number 6. Interventions work best, delivered with clarity, intention, and cultural humility. Slide 8 is where we are going to discuss the closing session. So, how we close the therapy session is just as important as how we begin it. Social workers summarize the key themes discussed, highlight client strengths, and clarify any tasks or reflections for the week. Chang in 2018 described closure as grounding process that helps clients integrate insights. Before ending, we check in with the client about how they are feeling and whether anything remains unresolved. This ensures emotional readiness before they transition out of the session. When then we then schedule the next meeting and confirm expectations. A thoughtful closing supports continuity, safety, and client empowerment. In slide 9, there is the follow-up. Follow-up occurs outside of the session, but is essential to professional practice. This includes writing accurate, objective documentation, monitoring the client's progress, and adjusting goals or interventions as needed. Documentation also protects clients and practitioners legally and ethically. Chang 2018 highlight that competent social work practice requires reflection, reassessment, and continual improvement. Follow up may also include providing referrals, coordinating additional support, or consulting with colleagues when necessary. This step ensures the therapy process remains client centered, ethical, and aligned with professional standards. Slide 10 is going to go over the references that were discussed, reflect the foundational materials that inform this presentation, including Chang, textbook on developing helping skills, and Sage's professional communication training videos. Each of these sources reinforces the importance of competence, communication, and ethical practice in social work therapy. Here, we're going to go ahead and say thank you for viewing this presentation. Thank you for your time and attention today. At this point, I'd love to open the space for any questions, reflections, or clarifications on the therapy process. Whether you want to explore specific skills, discuss challenges in practice, or learn more interventions, I'm happy to expand on any part of that presentation. Thank you for your time.